I said, ESPs help individuals access what we call higher levels of care, or more restrictive levels of care. And these are settings that remove people from kind of their everyday life, their living situations, and move them into treatment settings. So the first of these is a community-based crisis stabilization unit. These are sometimes these are referred to as respites. And these are alternatives to psychiatric hospitalization. They occur in community settings, so they're not in hospitals. They're typically attached to community mental health agencies, but they present as much more home-like settings. This is a voluntary level of care, so no one can be forced to receive treatment at a CCS. And because it's voluntary, I mean, it's an unlocked level of care. So when safety concerns arise, when things become a little bit more severe, they may need to refer then back to a crisis service if they can't kind of manage someone there. The average stay is 3 to 5 days, and they will provide, similar to inpatient settings, apologize for my dog, groups, individual medication management. Even though it's a voluntary level of care, individuals do have to stay there. So they can't just come and go. You can't go to work. You need to be there experiencing and engaging in all of the different treatment that they offer. But people often can leave if they have an appointment. If it's something really specific, especially as they may be transitioning out and resuming treatment with other providers in the community. So this works well for individuals experiencing what we would call moderate symptoms, moderate to severe, but cannot be presenting, as I said, with imminent risk. Safety, like imminent safety, cannot be a concern. But someone that needs more support and monitoring than maybe a partial setting where they're going home, or an outpatient setting, they need kind of more of that wraparound 24/7. This would be a really great option. And it's also really helpful because it's for people who might be isolating a little bit more, similar with the partial hospitalization. It can help with socialization and being part of groups that might pull people a little bit out of the isolation that they may be experiencing.